Here we have marked a perpendicular that has been dropped from the ASIS to the floor, and the second line which has been drawn from the femur outer surface dropped as a perpendicular to this perpendicular. Now once we have done this, the first image that we do is we do a lateral image of the sacrum. Yeah. Now here you will observe that this is one line, this is the second line. Now this is the iliocortical density. They should look as one line. Because they are looking as two lines, it means that your C-arm, the beam is not exactly perpendicular to the lateral surface of the sacrum. It should not come. Now if you see here, you can see one single line. This is a single iliocortical density that you see. Now our guide wire should go in this space. Now this patient has got a little sacral dysmorphism. Otherwise, we should have gone below that. Here if you can see one more shadow here. This is the shadow of the L5 root. So we have to be below this, in between these two structures. This is the trocar that has been jammed into the outer part of the iliac crest in the lateral view. So this is our basic starting point. Now after having hammered this into the sacrum, I am replacing this with a thick guide wire in the same canal. And now I am punching. I have replaced the trocar with a guide wire in the same hole. Then I have passed the cannula over the guide wire, and now I am punching this cannula inside the sacrum, so that then I will remove the thick guide wire and pass the thinner guide wire. Now I am passing the cannula for the cannulated drill, which will go over this. Right? Okay. Now when you are going to do this drilling, it should be a step drilling, and at every junction you should observe for the inlet and outlet view. Yeah. Now here you can see our guide wire has gone above the foramen, so we are in a safe zone. I have replaced the trocar with a cannulated drill guide, passed the 2 mm wire into that, removed the drill guide, and gone ahead into the center of the sacrum. Here you will find that my guide wire is fairly positioned exactly into the center of the sacrum. Even here you will be able to appreciate we are posterior to the anterior edge of the sacrum. Can you all see this? Ready, sir. Now this is the final seating of my cannulated drill. I don't want to cross on that side because I'm going to pass the other screw for the fracture on the right side from there, so I want some space on that side. I always call as a figure of 8 image that you see in an obturator outlet view. And remember, the inner pillar is the end margin of the screw, not the outer pillar. So this is where your final seating will take place. Stop. Now the beauty of this screwdriver and screw handle is I have seated, I have dismantled. At any given stage, if I find the screw is short, this screwdriver will engage the screw, this outer barrel will engage the threads, my guide wire is still inside, I can withdraw this and pass another screw. Now this is the same image that I am going to take to pass a anterior column antegrade screw and an LC2 screw. Remember, you will have to adjust your 2 screws if you are passing from this inverted thumb shaped shadow. You have to see that you adjust your guide wires in such a way that the trajectories don't cross each other.